Tonight in Medical Rounds, breast surgeons at Hartford Hospital are performing a revolutionary procedure that allows them to perform specific types of breast cancer surgery without leaving visible scars. Joining us live tonight to talk about that is Dr. Heather King. She is a breast surgeon at Hartford Hospital to tell us about this technique that is really making a big difference in the lives of breast cancer patients. Good evening, Dr. King. Thanks so much for being here.
Good evening.
Well, tell us about the hidden scar technique.
Well, we are really excited here at Hartford Hospital to be able to offer the hidden scar technique to our patients. It is allowing women to undergo surgery such as lumpectomies, where the surgeon can then place the scars either around the areola or in the fold of their breast, or even approaching it from the armpit location, making these incisions much less visible after their surgery. There's also a mastectomy approach called the nipple-sparing mastectomy, where the incision is also placed in the fold of your breast, allowing the woman to look down onto their chest and still see their own skin and their own nipple.
Boy, that's great to hear. Can all women with breast cancer benefit from these types of surgeries?
At this point, I would say about 80 to 85% of women can benefit from the hidden scar technique. It needs to be a discussion that's held with your breast surgeon, and it ultimately depends on the size of the cancer, the location of your cancer, and the shape of your breast.
And what about the results, Dr. King? I mean, certainly you want to eradicate the cancer. Does that happen as well as hiding the scar?
Of course. I mean, our first and most important thing is that we remove the cancer from the breast. But with this technique, we can now remove it, and still the breast can look wonderful and beautiful cosmetically afterwards.
That's wonderful. Let's talk a little perspective here. How does this scar minimizing surgery compare to the traditional methods of surgery? How large can a scar actually be with a mastectomy?
So the traditional approach for lumpectomies were that the incision would be placed in the exact location where the cancer was located in a woman's breast. Now, if we're hiding these incisions, it's less visible with the hidden scar technique. When you had it right over the incision where the cancer was located, it was obviously much more visible afterwards. A standard mastectomy usually was removing the nipple in the areolar complex and left a linear incision over the place where the areola was once located. So it really doesn't depend on the size of the incision at this point, because even if you need a large incision or a smaller incision, it can still be really well hidden and leave you with a good cosmetic look afterwards.
Boy, that's great to hear. Thank you so much, Dr. King, for sharing this great information with our viewers.